Well, I think it's a step towards making our classrooms and our schools safer.
Following the approval by the federal government of COVID vaccines for children aged 5 to 11, students and kids in Manitoba will soon be lining up to receive their first doses, and the news is welcome for the province's teachers, who say the step will help keep schools open and keep people safe.
Best learning occurs when students and teachers are together in the classroom, but we also have, a reality that it's a good number of people in the same space during a pandemic.
The feds approving the Pfizer-BioNTech shot Friday, making it the first COVID-19 vaccine for approved children in Canada. Health officials reiterating today the vaccine is our best tool to fight COVID-19. Manitoba teachers who have been on the front line of the pandemic in schools welcome the approval and potentially the relief it will bring.
It reduces that anxiety level a bit. It's not going to reduce it to zero, because we still respect privacy in terms of we're not going to be sharing the information about who's vaccinated and who's not. But I think, the population of Manitoba has largely embraced vaccination. I think the same thing will be true of students within this age group.
In the summer, provincial health officials reported about 230,000 children were unable to get vaccinated due to their age. Now that number is reduced to roughly 100,000, but is the province ready to roll out these doses? Earlier this week, they said yes.
The time is now to start having family conversations about how vaccination works and about how it helps keep people safe and healthy if you have young children in your home or if you care for young children.
Parents can start booking appointments on Monday as supply is on the way. Times for appointments specific to COVID-19 vaccines for children ages 5 to 11 are still being finalized and will depend on the delivery of the pediatric vaccine in the province. However, the first appointments are expected to be available as early as the end of next week. When doses arrive, they will be available at doctors' offices, pharmacists, urban Indigenous clinics, and pop-up clinics. The Winnipeg School Division, the city's largest, also says it's ready to help when called upon, with a statement saying in part, quote, Winnipeg School Division is working with public health and Manitoba education regarding providing space for the 5 to 11-year-old vaccine clinics where community access may be needed for families. At this time, there are no firm dates or locations for clinics. However, WSD will support those requests from public health when they are needed. As for vaccine-hesitant parents, Canada's top doctor, Theresa Tam, acknowledging attempts to reach that group.
There are parts of the country that are still undervaccinated. We do know that parents who are unvaccinated, it's probably going to be quite difficult to convince them that their kids need to be vaccinated, and we will continue to work with that population as well.
A particular regional focus on communities where hesitancy is high, like the Prairies.
They will be working at the ground level because they know their populations and their patients best.
The vaccination rate in Manitoba currently sits at roughly 85%. Health officials hope that number will rise as kids are able to go and roll up their sleeves. In Winnipeg, Morgan Majeski, City News.